Welcome to the short video on personality disorder. This is the second episode in the series, and this is a resource for healthcare professionals. I'm Dr. Krisha Patel, and I'm the mental health lead for the company. What is personality disorder? In the last session, I left you with the question, what happens when our personality traits and characteristics cause significant difficulties in our life and relationship with others? Let's think about someone who is very outgoing and extrovert, but to the extreme that they always need to be the center of attention in all situations. And let's say this particular trait of being very outgoing and extrovert has a significant negative impact on the patient's relationships with other people. What is personality disorder? Personality disorder is a concept whereby enduring personality characteristics or traits are extreme enough to cause distress or difficulties for a patient in their life and in their relationship with themselves, their relationship with others, and their relationship with the world. Personality characteristics or traits lead to real difficulties in their social and occupational functioning and their day-to-day living. These personality traits make life really difficult for the patient and often for other people as well. The problematic traits may have been noticed in childhood and early teens, though sometimes parents and other adults think the child will grow out of it by the time they reach adulthood. Now, it could be that these particular personality traits make it difficult for the patient to build and maintain close relationships, get on with people at work or their friends and family, could make it difficult for them to keep out of trouble, such as keeping out of trouble with the police and the criminal justice system. And it could make it difficult for the patient to control their feelings and self-regulate their own behavior and emotions. Personality disorder is a spectrum and can be mild, moderate, or severe. And whether it is mild, moderate, or severe depends on the impairment on that person's life and the severity of those symptoms or the severity of the particular personality traits and characteristics. And what we find is those with personality disorder at the more severe end of the spectrum have greater use of various resources such as social care resources, housing and homelessness resources, police and criminal justice system resources, general health resources such as general practitioner and accident and emergency use, mental health resources, and third sector services such as charities. It's really difficult to give exact figures of how many people have personality disorder, as many people with personality disorder will be undiagnosed, particularly those at the mild end who may never come to the attention of mental health services. There are also many people with severe personality disorder who haven't been given that formal diagnosis and undergone that formal psychological assessment to be given that diagnosis. And that could be because they don't want to engage with any sort of psychological assessment in the first place, or they don't want to engage with mental health services for whatever reason. And it's just a fact that many people with personality disorder are actually treatment resisting, so they don't seek help or support and they don't want any help or support from mental health services. Some studies estimate that 1 in 20 have a personality disorder, and that's whether that's diagnosed or not. Other studies have suggested that the real figure could be higher, such as 1 in 10. There are many types of personality disorder, and the two most frequently encountered in my clinical experience are emotionally unstable personality disorder, also called borderline personality disorder, and antisocial personality disorder. In the general and mental health setting, the most frequently encountered personality disorder would be emotionally unstable personality disorder, following a crisis or self-harm attempt, for example. And in police custody or the prison population where I work, it's most likely that I'm going to encounter those with antisocial personality disorder although there's still a significant proportion who have emotionally unstable personality disorder. Patients, healthcare practitioners, social workers, police officers, and people in the public will often confuse BPD, so borderline personality disorder, with BPAD, which is bipolar affective disorder. Both are very different mental health conditions, and it's really important to know the difference between the two. Borderline personality disorder, and I much prefer to use the term emotionally unstable personality disorder, EUPD, as it's far less likely to get confused with BPAD or bipolar affective disorder. But EUPD or BPD are both personality disorders where long-standing personality traits make life very difficult for the patient and those around them. And it has its own associated features such as self-harm, impulsivity, intense emotions, etc. Bipolar affective disorder is very different, and a simple explanation is that it's a serious mental health condition which is characterized by discrete episodes of mania or hypomania and depression, both of which are noticeable changes from the person's baseline personality. So it's really important not to get these two mental health conditions mixed up because they're both very different, but it happens all too often. Therefore, use EUPD instead of BPD if you can. The focus of the later sessions are going to be on emotionally unstable personality disorder and antisocial personality disorder, as these are the two that are most frequently encountered. So there are other types of personality disorder, such as schizoid personality disorder, paranoid, schizotypal, histrionic, narcissistic, obsessive compulsive, dependent, anxious, and avoidant. I'm not going to be able to cover these other types of personality disorder. So if you're interested in looking at the traits that make up schizoid personality disorder or paranoid personality disorder, I'll add a link to the Royal College of Psychiatry website in the description box below. Sometimes the patient clearly has some personality traits that make life very difficult for themselves, and these particular personality traits are having a negative impact on their relationships and their day-to-day living. However, they may not neatly fit into one of the categories listed. In these cases, when they don't fit very neatly into one category, they may be diagnosed with an unspecified personality disorder, or they could have a mixed personality disorder when there are features of two different personality disorders, such as features of emotionally unstable personality disorder and antisocial personality disorder. In the next session, we're going to learn about emotionally unstable personality disorder. Thank you for listening, and if you found this video helpful, please like and subscribe and check out the other resources on my channel.